We're going to dive in. I have lots of questions from our listeners, but let's really talk sort of quickly and succinctly about
Okay.
how your lovely horse might be giving you comfort in this time.
Okay, tell me. Okay. Well, horses are wonderful because they have no pretense. They just, whatever they're feeling, it's all right there. And so that's really good because she can reflect either my anxiety or my calm, and she does both. But they're also very affectionate. They have great personalities. They each have a different personality. She likes to, nuzzle me and put her neck around me to try and grab cookies out of my pocket. I have to be careful once because I had a cookie in my breast pocket and she grabbed it, so I have to watch out. But just the whole act of being with the horse, brushing its mane, feeding it. It's just riding it. It's a wonderful, wonderful thing. And it's a lot more than getting on that horse. It's more about just who they are. I mean, as animals, they are incredible animals. Yeah.
All right. Well, thanks, Shirley, and thanks for remind me the horse's name again.
This is Lucy.
All
and
right.
I named her the man who previously owned her. She's a rescue horse too.
Okay.
And she's doing great. Yeah.
All right. So Lucy will be joining us then for our conversation.
Yes.
Okay. Here's the first question from a listener and
Okay.
viewer. I have grave concerns about both the physical and mental health impacts of closing parks and recreation facilities. Everywhere I've gone since shelter in place was announced, people have been respectful of the 6-foot distancing requirement. Exercise and recreation are absolutely crucial to human well-being, and especially for people living alone. It is essential to get out into the outdoor public spaces where at least they can see other people and interact with them again from a safe 6-foot plus distance. When will this restriction on our parks be lifted?
Well, I hope soon, but it wasn't my decision. It was the regional park director. And I think what was happening is that you were seeing an overcrowding in parks and that distancing wasn't being adhered to. I think also one of the major concerns is that you have public bathrooms in parks and drinking fountains, and people were, using the bathrooms. Of course, they needed to, but there was lots of contact, human contact. There weren't Clorox wipes involved, and it was really a dangerous situation. So I think when Marin closed their parks, it made it particularly hard on us in Sonoma County because we figured that Marin County people would be coming up here and our parks would become even more crowded. I took a hike up Taylor Mountain with my dog the day before we closed parks, or 2 days before, and I didn't know we were going to close them. I didn't even know we were talking about it at that point. And there were a lot of people out there really enjoying the beauty of Taylor Mountain. So I hope we reopen them soon, but our first priority has got to be to get past this really difficult time where we are dealing with a virus that's so easy to spread. And we just don't know who has it and who doesn't, because there are a lot of people who have it and they just don't show any symptoms. So out of abundance of caution and need to control this virus, the regional parks director and the director of emergency services and public health decided to close the parks. So, but I'll keep championing to reopen them with additional cautions. Maybe we close the bathrooms. I don't know, but we have to find another way to help people deal with their mental health and be able to be outside.
Okay, here's another question about parks that's sort of specific. Doran Beach has a limit on the number of campers allowed to the campground. So couldn't the parks sort of set times and limits for people to access them? Isn't that one great solution?
That is a good solution. I would encourage listeners and members of the public to write in with their suggestions. Please contact me and my colleagues and the regional parks director on our emails with your suggestions.
Okay, Shirley, what's your email address for that?
Thank you. It's Zane at sonoma-county.org.
Okay.
And same for the rest of the supervisors too.
Great.
And not as Zane.
All right, they have their own names.
Yes.
All right, here we go. Another question. How do you prepare to deal effectively and humanely with those who will suffer and need intervention for mental health when the news says there's not even going to be enough beds available for just the regular, first of all, for COVID, and second of all, for the rest of the problems, the heart attacks, the broken legs. So where does mental health fit in? I know you've been a champion of mental health.
I actually think this whole crisis with this virus is elevating the importance of mental health for all of us. And so I'm hoping that's going to be a silver lining behind the crisis. First of all, people need to take care of themselves and their loved ones and really concentrate on that self-care. I'm confident there will be enough beds for all of those things that the listener stated, because we are preparing to expand facilities right now so that we can have the people who are the most seriously ill be in the hospitals, but other people will have an opportunity to be in a healthcare setting. We're looking at hotels, we're looking at all kinds of different facilities right now and preparing for that surge that we are very concerned about. Meanwhile, there is lots of hotlines where people can talk. And those are free. And so by all means, utilize those. And hopefully you can put them up on your website. They are up on the county website. You can call the suicide hotline. You don't have to be suicidal. You just, maybe you're feeling anxious or depressed or desperate. By all means, there's counselors, trained counselors on that hotline. Give them a call. There's all kinds of virtual groups, support groups too. Lots of caregivers are struggling right now. Because they've had an additional burden, no respite. There are virtual support groups out there. NAMI has them, the Alzheimer's Association.
So NAMI, the National Association for Mental Illness. Yes.
Mental illness, you can go to, but I would encourage the listeners to go to our website.
Which is SoCo Emergency or?
.org, yes.
Okay.
And go to our website, you can find all kinds of links and resources. But there's right now, at any given moment, there's about 6 hotlines that people can call. 24/7 national disaster hotline. It's 24/7. So's the suicide line. So counseling is there. It is available. But the self-care is really important. And I just can't emphasize this enough. Social distancing does not equal emotional distancing. Social distancing does not equal emotional distancing. You need to stay connected.
Okay, thanks. That's fabulous. Now, here's a question that several people have had. What is happening to protect the Sonoma County homeless population? Is information being dispersed to them? And how is their mental health being taken into account?
We're absolutely doing all of the above. We have 8 public health nurses that are going out there and just dedicated to reaching the homeless. We're trying to get them housed in safe facilities. So we've requested 450 motel rooms through the state so that people who are homeless have a safe place where they can shelter and still have that distancing so as to not to contact the virus. There's a lot of efforts being done out there, and I guarantee you they are at the forefront of our minds. The homeless along with seniors. And seniors, the reason why we have to remember them is because this virus is really profoundly dangerous if you're a senior, especially if you have any type of pre-existing conditions, whether it's heart disease or diabetes or high blood pressure. So there's lots of efforts there. And every morning we get a debriefing from our emergency operations center, the supervisors, and I can assure you that our emergency operations center is doing a fabulous job. We can't work fast enough, sometimes it feels like, but we do know that we're ahead of the game, that we're probably not going to look like China or Italy or Spain, or even New York for that matter. So we're working all the time to address these issues, and especially the homeless issue and taking care of our seniors.
Okay, I have seen in a couple of places that they're asking for volunteers who might be part of a phone tree checking in with seniors who don't have anyone else to check in with them, things like that. I know it during the fires, volunteers were marshaled very effectively but in a number of ways. Are we thinking about the possibility that we might be able to marshal volunteers there, just civilians who might be part of a check-in phone tree?
Absolutely. I checked out the volunteer link on our webpage this morning. It needs some development, I'll be frank. There's not enough opportunities down, but I think mainly in terms of delivering meals, food bank, and then volunteering for maybe some of the social support groups as well through organizations like NAMI and Catholic Charities. You Are Not Alone program, which is a telephone program. There's all kinds of opportunities out there, but you might need to go to some of the agencies directly. Most all of them have lines, so they're operating. It's just that they're operating virtually. But I would encourage the listeners to go to the volunteer center and go directly to them and say, this is my skills, this is what I'm interested in. Be aware that if you're 65 years or older, you're probably, you could volunteer at home, but you can't go out because those people we need to take care of especially.
Sure. Shirley, when you say the volunteer center, how can we find that online? Does it have a more extensive name?
That's online. That's on the front page. It'll say volunteer opportunities.
Front page of SoCo Emergency?
Yep, that's
Okay.
all there for SoCo Emergency. So
Great.
there's a whole FAQs there too.
Yes.
Lots and lots of questions and answers. There's a lot of information there, but I want to assure the listeners that we're constantly developing it as well.
Good. Here's another question about testing. People throughout the county are very anxious about testing, and that's making them worried and concerned. There's a reason that people, you know, some of us are called the worried well. And even if you're sick, you may not be able to get testing. So what mental health resources might be available specifically to address people who really, really want to be tested and they absolutely can't be in the current climate?
Yeah, so yeah, I understand the question is how do I deal with this reality? First of all,
Yes.
There's more tests out there, but we don't have enough equipment,
Yes.
the swabs, things like that. We're waiting. The state's ordered, the feds have ordered. We're waiting for some of that equipment. So we hope that there will be a lot more testing in the days to come. But you have to have some pre-existing conditions and have the symptoms as well to get tested. You need to call your doctor, not to show up at the emergency room. So this is something that we have to pull together to do as a community and to help address our anxiety over this issue is that, again, there's the counseling hotlines. I'll say that the counselors, the licensed therapists are able to do regular both groups and individual therapy virtually. So the insurance agencies, if you're worried about whether or not your insurance would pay for that, it is being paid for. So if you do have a therapist that you've already connected with, by all means call them and make an appointment. Otherwise, the 24-hour hotlines are great, and there are family support groups, there are caregiver support groups, there are all kinds of support groups out there. But you do have to do a little digging yourself in terms of the phone calling. Yeah, it's hard. We want to acknowledge that it's a very anxious time. I would really encourage people to spend time exercising in their neighborhoods, to eat well, to sleep well, to do things that normally you don't have enough time to do, whether it's playing ball with the dog or whether it's reading a book. Listening to good music, but turn off some of the television because it makes us a lot more anxious when we're constantly listening to these very traumatic and disturbing media and news lines. So please do. And I want to thank Sonoma County. Sonoma County gets an A in terms of how they deal with disaster. And people are really being supportive and really cooperating. It's not a normal way of living. It's called disruptive living. It is a disruption in every single way. And we acknowledge that, and we acknowledge the need. to take care of ourselves, take care of our loved ones, and use the resources that are there.
All right, Shirlee, Zane, I really thank you for joining me, and thanks to your emotional support animal over your left shoulder. I've really enjoyed talking to you both. Will you stay in close touch with us, because the emotional health and well-being of our community is foremost in our mind right now?
Absolutely. I have a call in an hour with a group of mental health providers. Those calls are happening almost every day. So we're trying to find ways that we can provide additional support and really work together. So
Good.
I will absolutely stay in touch. Yeah.
Absolutely. And make sure that we have all those resources. We'll be putting them up on the screen at the end of our Tuesday evening broadcast. We'll check with you to make sure we've got a robust list.
Sounds wonderful. Great. Thank you so much.
All right, Shirley, thanks.
Thanks.